So we've just done our presentation, a multidisciplinary presentation, and the question came up of what did we learn from the others?
Yes, and I know for me, working with the rest of the group, learning about the talus and doing a presentation on the talus, I was able to learn something from each one of you. So when I was starting with anatomy and some basics, I was able to progress my knowledge of the biomechanics with learning from Peter. And then I was able to progress my knowledge with taking that to imaging and treatment options with Nancy, and then furthering that with prevention and then advanced treatment options with rehabilitation with Myra. So it was a perfect base, but then really learning kind of that advanced second step, third step, fourth step, sometimes 10th step on as we progress each through. So I just want to thank you guys for teaching me and collaborating so that I could learn from you. It was a great experience.
It's wonderful to learn, the specificity of each one of you. So you come with these wonderful anatomical slides and knowledge of that from a sports medicine perspective, and then bring it to the biomechanical perspective of how that fits into that.
At one of my orthopedic meetings, it would be very difficult. Even though all of you are fantastic and I learned so much, I'm not sure that all orthopedic surgeons are open to learning, and it's very easy when you're in isolation to get tunnel vision. And even so, I don't have this kind of access to fabulous physical therapy. I never get this amazing introduction and explanation so clearly and dance related of biomechanics and of anatomy and the sports medicine. That is a nice review, even though I'm looking at it all the time. You know, suddenly when you show those amazing pictures, I remember, that's how that talus goes. So I think that we're really lucky, and I feel fortunate and honored to get to work with you guys because I learned so much from you.
I do work with orthopedic surgeons and sports physicians and other physiotherapists and 2 osteopaths. So I do get that chance to interact, but there's never any time, it's very much with time economy. And then, so when you get to actually work with people from all over the world, and we've communicated just via email, it really has brought it all alive. And I know that when I go back and I say I treat the talus every day, I will go back and I'll think of what Kathleen said and that pitch and roll that Peter talked about, and Nancy's treatment options, and I just feel more educated.
I agree completely. That's what I love about the meeting and what I love about this group is that we all bring unique perspectives, and hearing that other people in IADMS, this is also why they're here.
And I think it's a model for the whole of IADMS. We're trying to bring people, the audience, together to understand each other, and so we were doing it, showing that this is how you do it.
I would say that I love the direction of the dance culture being more health-minded, and focusing on that, and that trajectory has been very clear, this artist-athlete relationship. And as we're a multidisciplinary group, having those multidisciplinary approaches within the dance culture as well, with physiotherapists and biomechanics and physicians all working together with the dancers as a team approach. That's something that I've loved to see, and I find are some of my most successful relationships with my colleagues as well as my dancers and teachers.
That the dance world would have less fear of knowledge and questioning things, and I think this is going to be happening. It's a generational change. I think in 1930 they said that the Nobel Prize winner said, science advances because someone retires. So sometimes there's a regeneration of people have set beliefs sometimes, and we're seeing this change in companies now. You have company directors who've been to Harvard and things like this. It's changing. Before there wasn't this and there was a kind of fear of a dancer who has got educated, and so I think it's great to have this feedback, and I think it's very exciting to see this in the future. That being said, we have to make better dancers. They'll listen to us when they're better.
But by better, do you mean performance enhanced, like a better performer of dance as well?
Choreography is always changing. What was contemporary in 1990 is not contemporary in 2010. So it's always changing, and we have to adapt. very much and listen to where they're coming from. This new generation coming now is very different. We have to adapt things very quickly to their needs. I was saying before, information is everywhere now, but they'll need a guide on that information. What we do in dance medicine would be a wonderful model for all public health. What we're doing in dance medicine, in a way, is the forefront of where we should take all medicine. A healthy dancer is a better dancer. Healthy choreography is the public will also feel that, this respect. Our ancestors built theaters for public health. You go to the ballet, you go to the opera, you feel better. It's there, it's been established by our ancestors to make people feel and be better. And if we're, in a sense, we're part of a much bigger movement, and we've just kind of lost the links to that somehow.
And I feel the dancers that I know are far better educated than ever before, and they've got a voice, and they've got opinions, and they make them very, very clear. Then we do tend to be a few steps ahead of possibly our artistic managements. So we've got to really appeal to them to come with us and to give the dancers what they need.
Directors change, choreographers change, but I think in general, compared to 10 years ago, they are more open to at least inviting me to give injury prevention lectures or talk about something like strength and conditioning, whereas 15 years ago you could not speak in a ballet company about that, for example. And I do find that individual dancers, I agree with you, are more educated, but then we still have the danger of the internet is everywhere, and sometimes the less educated dancers want to do that because they see it on the internet, and so we get those kind of injuries. So I think it's still sort of murky waters to navigate, because at times you're very inspired and said, look, someone listened, and oh, they want me to talk, and I get to speak to the teachers, and it's wonderful. And then the next week you're dashed.
No.
Your hopes are dashed and things have shut down.
And there's also a groundswell when the dancers themselves are asking for it. When at some point it gets to be an epidemic,
Yes.
Mm-hmm.
things move, even if there's restriction. You know, it's a slow process, but we're getting there. You know, we're IADMS is presenting at the Prix de Lausanne, at the Youth America Grand Prix. This is a big step. So we just, after intervening at the Youth America Grand Prix, they've changed their rules so that the young students cannot present in point before a certain age, because and this came from intervention with IADMS and with the director of Royal Ballet and the Stuttgart Ballet. So this is quite new. So mainstream is asking for this knowledge now and for this care.
I like that about IADMS. I think that's what gives me hope, is that while we do have maybe 5 steps forward, 3 steps back sometimes, it's so encouraging, to see that from this multidisciplinary approach that we are a voice on the internet, and yes, we're growing to be a stronger voice on the internet, but that as a multidisciplinary approach, we have those perspectives of the educators and the dancers and the clinicians, and the scientists, that we all can work together and really help to make not only our individual fields, but the whole field of dance, medicine, science, as well as dance medicine and science, to have all of that grow together to be the best that we can all be.